Glenn, what are the factors you would consider when you're choosing the type of neuromuscular relaxant, the actual drug you're going to pick?
Well, I think there's several factors that go into the decision-making process. First, I think there's surgical-related factors. What is the duration of the procedure? Is it going to be a short procedure? We have, for example, some surgeons at our institution who can do a lap chole in 25 minutes from skin to skin. That may be very different from a Whipple procedure. It's going to be 6 hours. So duration of the surgical procedure. What are the requirements for muscle relaxation during the procedure? Is it a procedure that's going to require deeper levels of neuromuscular blockade, or is it not essential for the performance of the procedure? And then there's patient-specific factors. Are there underlying disease processes? If the patient has renal disease or liver disease, that may affect our choice of drugs that we use. For example, in those conditions, we may choose to use benzoyl type medication, which is less dependent on metabolism from those organs.
A drug like succinylcholine, when would we use that?
That's a good question. They're very short duration. It's metabolized by plasma cholinesterases. Get a duration of about 10 minutes with succinylcholine and a very fast onset. We're going to get an onset about 30 seconds with intubating conditions, at about 60, definitely by 90 seconds. So for a rapid sequence intubation, Sux historically has been the go-to drug to consider for that. So it has, as a depolarizing agent, certainly has a list of side effects that we need to be concerned about, including if the patient has severe liver disease or has a pseudocholinesterase deficiency. At that point, your succinylcholine could become a longer acting, or at least an intermediate acting, neuromuscular duration.
And Glenn, so it's a good, I think, segue. What would be the advantages or disadvantages of using rocuronium in that setting for a rapid sequence intubation?
In a rapid sequence intubation condition, you have to use a larger dose, typically 1.2 milligrams per kilogram. It's a typical dose. You can use it in a more rapid sequence situation. Now, it's not quite as fast as succinylcholine, but close when we use that. One of our concerns in that situation is we get on a cannot intubate, cannot ventilate scenario. That's one of the situations we've been reluctant to use rocuronium in those particular circumstances. However, now with the advent of Sugammadex, we can actually reverse that. And if we give a dose of 1.2 milligrams per kilogram to intubate the patient, followed 3 minutes later by a dose of 16 milligrams per kilogram, we know we can reverse that level of block within about 3 to 4 minutes. So it's another option we have now in a rapid sequence circumstance. Now, if you're going to do that, though, you have to be prepared. A 16 milligram per kilogram dose is fairly large. So you have to have the availability, particularly if we have larger patients. Again, Sugammadex should be dosed to actual patient weight. So you have to be prepared in that situation if you have enough Sugammadex to actually reverse that level of blockade.
Yeah. It's important to note also that if you intubate with rocuronium at 1 to 1.2 milligrams per kilogram and you decide you're in that can't intubate, can't ventilate scenario, yes, you can restore motor function in 3 minutes very quickly, but you still have your induction agents present and you're still in that can't intubate, can't ventilate scenario too until you get the redistribution of the propofol or whatever induction drugs are there. So it's not a get out of jail free card. You can restore motor function, but you still have the airway issue that you were left with that you will have to follow ASA emergency airway guidelines.
Yeah, that's a very good point, Mark. And I think, in summary, you really are looking at all these drugs, the pharmacologic properties of the drugs when choosing a relaxant, the patient factors, the surgical factors, duration of the drug itself, and so on. And now, prior with, when we didn't have Sugammadex as a possibility, now you're looking at the type of reversal agent that we can use, which also can play a role into drug selection.
Absolutely.